This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know, I know firsthand about the top-notch cardiac care that you'll find at Peninsula Regional Medical Center, but that care goes beyond the time spent in the hospital after a cardiac event or even a surgery.
Yeah, for more than 30 years, heart patients or patients who are at risk for heart problems have been participating in something called cardiac rehab. It's part of the Cardiovascular and Pulmonary Rehabilitation and Preventative Cardiology Department at Prmc. Now, I recently made a visit and found out this program has led to much more than recovery. It's sent some patients to a whole new level of fitness, and some of them gained lifelong friendships along the way.
6 days a week, you'll find Patrick Devaney putting in some hard work as part of his cardiac rehab program.
20 years ago, I had open heart surgery.
Pat credits the program for his current state of physical fitness and, most importantly, his heart health.
Now, after all this time in rehab, with the help of medical professionals and the exercise, my blood pressure is well within the recommended range. My cholesterol is low normal, and I weigh much less now, 20 years later, than I did when I had heart surgery.
The program was started back in the late 80s.
Peninsula Regional had always had a long-standing, solid experience in treatment of cardiovascular disease, but they didn't have the rehabilitation or what's called as primary and secondary prevention effort.
But it's so much more than exercise.
It truly has physiological benefits in reducing mortality, reducing readmissions for patients that have had a heart attack, bypass surgery, congestive heart failure, by coming into a structured cardiac and pulmonary rehabilitation program.
Rosemary Slacum of Mardella Springs joined the program to encourage her husband, who had to have quadruple bypass surgery. Rosemary had a history of high cholesterol, and 3 of her siblings have had heart attacks, one of them fatal.
I haven't had one, but my surgeon told me that if I hadn't had some help, it probably would have happened in a couple of years.
Sarah Beal is an exercise physiologist with the program.
What that means is we like to study the response of patients when they're exercising, what their blood pressure does, what their heart rate does. We also like to educate our patients on, risk factors for heart disease, as well as healthy diet habits, healthy diet tips, stress management. So it's kind of an encompassing profession.
Many patients start cardiac rehab as an inpatient following a cardiac event or surgery.
We get them up, we get them exercising, but we also provide them with education. Again, this is going to be about risk factor modification. When they get home, what they should be doing as far as modifying their lifestyle so that they can improve their overall quality of life.
Phase 2 is the telemetry monitored, outpatient, medically supervised exercise program, which is truly the foundation of cardiac rehabilitation. This is where they improve their functional capacity, they're telemetry monitored. We provide education to help them modify their lifestyle.
Terry Greenwood started in phase 3.
I had a very minor heart issue, but I had high cholesterol and high blood pressure.
That was 20 years ago.
I think it certainly improved the quality of my life. I feel much better coming here. I was tired a lot before. I come early in the morning. You don't always look forward to getting up and coming to exercise, but after I have been here, I feel much better.
The ongoing exercises, lifestyle changes, and medical monitoring go a long way in preventing cardiovascular problems, but most here agree there's one more very important component.
I come here too for the camaraderie, because there are a lot of us old guys, I'll say it that way, who come here, and it's almost a social event between the staff and your friends that you see when you come.
My husband says that we will do, or he will, and I will too, we will do it for the rest of our lives, and as long as we're able to do it, because this is really just a great, wonderful program. It really is, and the staff here, they're all really super. They really are.
The cardiac rehab program at Prmc is one of the most comprehensive of its kind in the Mid-Atlantic region, with more than 1 million patient encounters since its establishment in 1986.
1 million encounters.
Mm-hmm.
Wow.
A lot of healthy people.
A lot of healthy people.
Mm-hmm.